the first two were a bit more auditory. The second two will be a little bit more visual.
Keep you awake.
So keep you awake. Okay. So this is the title of our study, CHIWOS, the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, and we used a women-centered, community-based research model. My name's Mona Loutfy. I'm an infectious disease specialist, and I work in Toronto, and 80% of my patients are women living with HIV. I'm a clinical researcher at Women's College Hospital and Women's College Research Institute, and I do research on topics that are most important to my patients. And based on that, I founded the Women and HIV Research Program at Women's College Research Institute. CHIWOS is a 5-year, multi-site, prospective cohort study that's rolling out in British Columbia, Ontario, and Quebec. It's funded, thanks. It's funded by CIHR. We received close to $1.2 million from CIHR, and at the end I'm going to talk about one of the major challenges which Beryl spoke about, which is funding. And to carry out community-based research, it tends to be very expensive, wouldn't you say? Mm-hmm. Our target is to enroll 1,400 women living with HIV across the country, and we're operating using community-based research practices and GIPA, which stands for the Greater Involvement of People Living with HIV. We've had 2 phases, a formative phase, and we're now in the full national formative or survey phase. These are our study goals among HIV-positive women to assess the barriers and facilitators of women-centered HIV service use and to assess the impact of such use on overall and sexual, reproductive, mental, and women's health outcomes. Oh, yeah, okay. We are practicing from a critical feminist, anti-oppression, intersectionality, social justice, social determinants of health, GIPA, MIWA, and community-based research frameworks and principles. It sounds like a lot, and luckily I don't have to do this. Shazia is going to go through how we operationalize those frameworks and principles in an actual project.
Okay. Hello, everyone. It's great to be here with all of you. My name is Shazia Islam. I am the Women's Health and Support Coordinator at the Alliance for South Asian AIDS Prevention. It's an AIDS service organization in Toronto. And if you'd like more information about our programs and services, my ED, Vijaya Chikramani, she's just back there, and she will be here during the networking session, so please feel free to ask her questions about ASAP. Along with my job at ASAP, I am equally proud to be one of 20 peer research associates for the CHIWOS study. And of course, my interests range from community-based research, that's why I'm here, PAW's Women's Health and Agency, and of course, LGBTQ rights and advocacy. And I hope to see all of you at on the streets during Pride Week. So happy Pride. Okay. Okay, so principles of community-based research. In terms of the CHIWOS context, there's been a lot of involvement with women living with HIV/AIDS. We are one of the primary agents and drivers of the research study, and I think that's really, really important. Again, that speaks to GIPA, which is the greater involvement of people living with HIV/AIDS. In terms of the hiring, the job postings were circulated, applications reviewed, and interviews completed. So once again, we have about 20 PRAs, including 1 allied interviewer in Ontario, 9 in BC, 9 in Quebec, along with an allied interviewer. And we'll speak more about allied interviewers a little bit later. We also had a fantastic training, 3 to 4 day training back in the spring of 2013, where peer research associates had the opportunity to network and build relationships with their peers. The curriculum itself, the training was very, very comprehensive, which included some of the frameworks that Mona had just mentioned in terms of anti-oppression, critical feminism, intersectionality. We also went over research principles and, of course, ethics, the logistics of actually putting the survey out there, surveying techniques, problem solving, as well as a very, very important one for PRAs, and that is self-care. We also did follow-up trainings by phone, and a lot of that had to do with navigating the survey, the online survey, because we are working with technology, and technology is not always, guaranteed. And then, of course, we have our monthly PRA teleconferences, which is a fantastic opportunity for PRAs to, again, come together to get updates, to give feedback, to express concerns, ask questions about how the study is going. Okay. In terms of operationalizing CBR, obviously it takes a very big team to keep CHIWOS running, and so we have a number of different committees and groups that are involved, including the national and provincial core research team. I myself am the OCRT rep for Toronto, and I absolutely am loving the position. We also have the steering committee, which again includes many women living with HIV/AIDS. We have the community advisory boards, which have been formed in each province to further the collaboration and cater to local needs. Again, the peer research associates like myself have been hired as partners and collaborators to guide the study. And then I'll talk a little bit more about the KTE component. Okay. In terms of the study update, the study was launched, the online survey was launched on October 1st, 2013, which was followed by the French survey on November 15th, and since then it's just been gaining and growing in momentum, and it's been great. So nationally, we've been able to reach 54% of our goal, with 750 participants interviewed. In Ontario, 396 women living with HIV were interviewed. In Quebec, 158. BC, 196. And again, we've been receiving a lot of positive feedback from PRAs and participants about the survey. We've also been getting, some good sort of constructive feedback, which we can also talk about later. And again, there's ongoing support structures for our PRA teams, which is awesome. Okay, in terms of KTE, we are on Twitter, and so we like to tweet a lot. So please follow us on our Twitter site. We also have a website that gives you a lot more details about CHIWOS. And then we also have a Facebook site, so please like us. And I'm really happy that I'm using the social media lingo, so hopefully that connects with all of you. We also have a national newsletter, and it's actually out, and you can access that on the website. And then, of course, again, we have our own PRA-led KTE activities within our community, so within my own networks as a worker for ASAP. Okay, and I think we're...
Okay, so we now only have, I think, 1 minute to discuss challenges and successes. So I want to really just share with you 2 challenges with 2 solutions. The first one, and not the funding one, which means in terms of getting money, but I want to. What I want to share is that the institution. I'm interested to see if others have this experience from an academic perspective. I found at the beginning academic institutions didn't necessarily understand community-based research. And how could you be hiring women living with HIV to be your research assistants? And so it took a lot of time having meetings and teaching and educating the institution staff, the finance about what community-based research is. At the same time, it took educating the community that we had to practice within institutional guidelines for finance. So my first, and navigating the two sides and being the person in the middle, I find sometimes challenging. The solution I found is very clear communication, constant communication, education, being positive on both sides about it. So now I can say that Women's College Hospital and Research Institute are very supportive of our projects, and it's really great when the institution's staff and ethics boards say, we love your project. So, and also now the community really do understand that there's procedures at the institution for finance. The second challenge that I want to go over has to do with self-care. When you're dealing with community-based research projects, and I think all of our projects really do deal with vulnerable populations, vulnerable and marginalized women, and we're also hiring peer research associates, you're going to deal with mental issues, you're going to deal with breakdowns within. Could be the researchers, right? Could be the peer research associates, could be the participants. So you have to be prepared and to have solutions for that. So we actually have a self-care and safety policy. We've hired counselors that are available most of the time, 18 hours of the day. And it's just putting in procedures like that and being very methodical and to make sure that all these little aspects are covered. Thank you.